Skin cancer. Two words that may sound unfamiliar, but are actually very common, as it is one of the most prevalent types of cancer worldwide. What is particularly noteworthy is that if detected early, most cases of skin cancer can be successfully treated, allowing patients to live healthy lives. Therefore, recognizing the early warning signs of skin cancer is not only medical knowledge, but also an essential life-saving tool for each of us. Let's learn more to know how to self-examine our skin and protect ourselves as well as our loved ones. First, let's understand what skin cancer actually is. It is the abnormal growth of skin cells, usually caused by excessive exposure to ultraviolet, UV rays from sunlight or artificial sources such as tanning beds. In fact, skin cancer is not a single disease, but a group of diseases with three main types: basal cell carcinoma, BCC, squamous cell carcinoma, SCC, and melanoma. Basal cell carcinoma accounts for the majority of cases, about 80%. This type usually develops slowly and rarely metastasizes, but if neglected, it can deeply invade and destroy local tissue, causing deformity. Next is squamous cell carcinoma, accounting for about 15%. This type also develops gradually, but has a higher risk of spreading to other organs, especially if not treated promptly. And finally, melanoma, the most dangerous type. Although it accounts for only about 5% of skin cancer cases, melanoma has the ability to metastasize quickly and aggressively, directly threatening life if not detected early. Why should we be vigilant about skin cancer? The answer is very clear. When detected and treated early, the cure rate is almost absolute. But if the initial signs are ignored, the disease can progress silently, become difficult to control, and even pose a life-threatening risk. Early detection is the golden key to protecting you and your loved ones. Who is more likely to get skin cancer? Everyone can face this risk, but some factors significantly increase the likelihood of developing the disease. First and foremost is excessive exposure to sunlight, especially severe sunburns during childhood. Using tanning beds is equally dangerous because artificial UV radiation is as harmful as natural sunlight. People with light-colored skin, hair, and eyes usually have less protective pigment, making them more vulnerable to UV damage. If you or a family member has had skin cancer, the risk of recurrence is also higher. Notably, people with many moles, especially large moles, irregularly shaped ones, or those with more than 50 moles on their body, should also be more cautious. A weakened immune system due to illness or the use of immunosuppressive drugs is also a risk factor. The older the age, the higher the risk of skin cancer due to the cumulative effects of sunlight over many years. Some toxic chemicals, such as arsenic, have also been confirmed to increase this risk. Understanding the risk factors will help you be more proactive in prevention and recognizing abnormal signs. So how can skin cancer be detected early? Regular self-examination of the skin is the first step. Extremely simple, but very effective. You should check your entire body at least once a month, using a large mirror, a handheld mirror, and good lighting to clearly see every area, including places that are less exposed to sunlight, such as the back, between the toes, under the nails, and the private areas. Don't hesitate to ask a family member to help check the hard-to-see areas. For melanoma, the golden rule for identification is ABCDE. A. Asymmetry. If you divide a mole into two halves and the two sides are not identical, be cautious. B. Border. Jagged, serrated, unclear edges, different from the smooth, regular border of a benign mole. C. Color. More than one color on the same mole or skin lesion, for example, black, brown, red, blue, white. D. Diameter. Usually larger than 6 mm, which means larger than the tip of a pencil. But note that melanomas can be smaller, so do not be complacent if there are other abnormalities. E. Evolving. Any changes in size, shape, color, or new symptoms such as itching, pain, bleeding, scabbing are warning signs. With basal cell carcinoma or squamous cell carcinoma, the signs are also very diverse. It could be a small ulcer that does not heal after a few weeks, a shiny pearly or waxy bump, a flat brown or red patch, or an area of skin that looks like a shiny flat scar, white or yellow in color. Specifically for squamous cell carcinoma, the manifestation is often a hard red nodule with scales, a deep ulcer resembling a non-healing wound, or an area of skin that looks like a wart. In addition, you need to pay attention to any wounds that do not heal within 3 to 4 weeks, areas of red, itchy, scaly, or bleeding skin, newly developed moles, or spots that grow quickly, or any moles that begin to itch, hurt, soften, bleed, or secrete fluid. To effectively check your skin, start from the head. Part your hair to examine the scalp. Carefully inspect the face, neck, ears, then the chest, abdomen, underarms, both palms, fingers, especially under the fingernails. Use a handheld mirror to check the back and buttocks. Don't forget to check the legs, feet, toes, soles, and under the toenails. The genital area should also be checked, even though the risk is lower. A small tip is that you can take photos of moles, marking their size to monitor changes over time. This helps you or your doctor easily compare and recognize any abnormal changes. When should you see a doctor? As soon as you notice any mole or lesion with ABCDE characteristics, a wound that does not heal after 3 to 4 weeks, a new or rapidly growing lesion, or a mole or spot showing abnormal signs such as itching, pain, or bleeding. If you are in a high-risk group, schedule regular checkups with a dermatologist. Doctors have specialized tools like dermatoscopes for closer examination, and if necessary, they will take a tissue sample for accurate testing. Besides early detection, prevention is always the optimal measure. To protect the skin from UV damage, you should avoid sun exposure during peak hours from 10 a.m. to 4 p.m. Always use broad-spectrum sunscreen with SPF 30 or higher. Apply enough amount and reapply every 2 hours or after swimming or sweating. Wearing protective clothing, wide-brimmed hats, and UV-blocking sunglasses are also effective measures. Especially, absolutely do not use tanning beds. Maintain the habit of monthly self-skin checks and annual medical examinations, or more frequently if you have many risk factors. Don't forget to educate children about the harmful effects of sunlight and skin protection habits from an early age. Skin cancer can be frightening, but with knowledge, proactiveness, and good habits, you can completely control and prevent this disease. Never underestimate any signs on your skin. Starting today, take a few minutes each month to check your skin, remember the recognition rules, and share this information with your family and friends. Your vigilance and understanding can save your own life and those around you. Correct knowledge is power. Take the initiative to protect your health because no one takes better care of you than yourself. If you have any worries or doubts, do not hesitate to consult a specialist doctor for timely advice and support. A healthy, safe life starts with small actions, beginning with self-examining your skin today. Take action to protect yourself and spread the message of skin cancer prevention to the community. Don't let small signs be overlooked, because every proactive moment is an additional opportunity for you and your loved ones to live healthily.